What is seroma formation? The seroma is nothing but a fluid collection in between the skin and the muscle layer. See, few surgeries is very commonly we see. One is the gynecomastia, the male breast correction surgeries, and second one is the tummy tuck. Even in liposuction, sometimes we see. See, why it happens? See, normally body secretes fluid. Like even if you had any external injury, you can see some fluid keep oozing. Okay, that is very normal. So the same way when we are doing a tummy tuck or gynecomastia or whatever the like liposuction, we create a lot of internal wounds. So it tends to keep secreting fluid. The fluid usually get absorbed by the body if it is a small quantity. But sometimes beyond one limit, body can't handle the fluid, so it keep accumulating. And we observe few things. Say example, gynecomastia, if you leave a small fat layer over the muscle or over the skin, just keep a small thin fat layer over the skin or the muscle, the seroma formation is very less. Same way in tummy tuck, if you leave a scarpa fascia fat, the seroma formation is very less, because the little bit of fat is needed for the absorption of the seroma. This is our observation here. And second thing, if the cavity is big, say example, I do a grade 4 gynecomastia or a huge tummy tuck, and cavity is very huge, sometimes the body can't handle there is a lot of space, so the fluid tends to get accumulated here. So only we do something called quilting sutures. We wanting to obliterate the cavity, so we put our sutures inside and bring the dead layer, like we want to reduce the dead layer, so we put a quilting sutures inside so that the dead space will be obliterated. But whatever we do, sometimes we get. What other reason you might have the seroma formation? One other reason is the compression is not adequate. See how we are doing a quilting suture, same way we have to compress the skin over the muscle so that there is no space in between, so fluid accumulation won't be happening. Surgically, the quilting sutures helps. Sometimes even betadine wash will help, because betadine will act like a local sclerosing agent. So before surgery, before closing the wound, giving a betadine wash also helps, and a diluted betadine wash, not direct betadine wash. And third thing is leaving a thin layer of fat will help. And post-surgically, giving a compression garment will be a helpful thing. About the drain, whether the drain will prevent seroma, actually not. See, if you keep the seroma's major problem happen only after 7 days. The initial little bit of fluid collection body will handle well. Usually seroma, the resistant seromas we see usually after 7 days only, difficult to handle. So the drain, immediately keeping it doesn't matter actually. Sometimes I keep the drain because if the fluid accumulation is so much, that itself sometimes produce the skin necrosis, skin death and all. So to prevent the huge cavity and all, I keep a drain for 1 or 2 days so that the cavity will be obliterated. Even the little bit of fluid collection will jeopardize the blood supply to the skin. So drain actually literally no role unless otherwise a huge cavity. And once that resistant seroma, once you're coming for the seroma, with the seroma, usually we aspirate with the needle. Okay, so sometimes you need to come every 3 days once. So usually 2 or 3 sittings it settles. Some people it will be very resistant, and these kind of a resistant cases, usually we try to do a few other extra measures like doxycycline injection over that cavity. Actually, doxycycline injection is like a local sclerosis agent, so it will obliterate the cavity. Sometimes we put the drain and keep it for a longer time. After like usually this resistant the seroma is usually after 15-20 days only we see. So sometimes we give a local anesthesia, keep the small drain, and we wait for the fluid secretions to come down. That are extremely rare conditions. Even with the opening, we give a betadine wash. That's also act like a local sclerosant agent. And sometimes the atypical tuberculosis might also produce a similar kind of a resistant seroma. So sometimes we have to check when you're taking the fluid for the analysis, check for the bacterial as well as tuberculosis and fungal, all the check we have to do to find out why the resistant seromas are forming. One more important aspect is in massive weight loss patients, people on very much on dieting. Sometimes the protein levels will be very low, so that also tends to secrete more seromas. So in those cases, giving a albumin infusions will definitely help, and asking them to take a high protein diet along with that, giving the albumin infusion will definitely reduce the seroma. And sometimes some units they give regularly the albumin. It's an individual unit preference, but definitely there is a role of albumin in seroma reduction. So understand these things. Seroma is easy to handle in 99.9% of the patient. 0.1% of the patients needs a little extensive work, and but still it is manageable.